Alan Lewis Raw Conversation, where every voice has a story.
And welcome to podcast 20. Well, we haven't been recording for 2 or 3 weeks because we've been doing a few little changes. We have some new audio gear and we have a new audio and executive producer, Jacob, who's came on. So you'll get used to who Jacob is over the next few months and year or so. So I welcome Jacob. He's in the background and now and then you're going to hear him speak. And I have an amazing guest today. I have Professor Harry McConnell, who is, truly, if I am right, is a psychiatrist and a neurologist. Is that true?
Yeah, that's right, yeah.
Yep, welcome and thanks. We've been trying to get time for you to come down, and you're very busy, obviously, with your what you do and helping people and your work and everything you're doing at the moment. So I really appreciate you coming down here today. How are you feeling?
Yeah, that's great. Glad to be here. Thank you.
No, thank you. Harry, one of the things I first do, just to kind of get into it comfy too, is I got 3 pieces of paper in front of me.
Mm-hmm.
Okay, there's top, middle, or bottom. I'm going to get you to pick which one, and I'm going to hand it over to you and let you read the question out and just answer the question as politely and how you want to go.
All right, that sounds good. Shall we try the top then?
Sure. Okay, here we go. I'm sorry, it's sticking together there. There we go.
So I get to interview myself then,
yep,
yeah?
You get to read it yourself.
What is a piece of music that makes you emotional and why? Oh, wow, okay. Well, this one's really easy, I guess. Papa, Can You Hear Me? Barbra Streisand from her movie Yentl.
Yeah.
Very, very powerful piece of music for me. My daughter sang it at my father's funeral, and had not only me but everyone in the room in tears. It's a very powerful, emotional song, and I related very strongly to my own father. Yeah.
Okay, thank you for that emotional part and remembrance of your loss, and I'm sorry for your loss, and that's amazing, that your daughter sung that, and it must have been, amazing for the family to see her get up there and do that. Harry, tell me a little bit. We'll start at where you first grew up. Can you tell me where you grew up and just a little bit about your parents and brothers or sisters?
Okay, yeah, great. Well, I grew up in the States, in Pennsylvania, New Jersey, and Ohio, and Michigan mostly. And so it was an interesting, fantastic childhood in many ways. So I had an older brother, Bob, and then an oldest brother, Tommy. And Tommy had an intellectual disability. He had measles encephalitis, and so that affected his behavior and his cognitive abilities. And then later I had a younger sister and another younger brother. So so that was us.
And your mum and dad, what did they do for work?
Well, my father was a doctor,
Okay.
so he was a occupational medicine specialist, and he did a lot of community work. And then my mother was a medical social worker.
Okay, and obviously you moved to Australia. What year did you move to Australia, and why?
Oh, not till much later in life. I've only been here 20 years, so. So I moved quite a few places before that, really. Yeah. So
okay, where was one of the first countries you moved to after the United States?
When I was 16, I moved to France.
Yeah.
And so that was, and I was an exchange student there for a year. So that was a fantastic experience.
Okay. And what were you doing there? Medical? Was that your first part of medicals?
No, I was only 16. So I was living with a French family in France, and so that was really just learning French culture. So that was, I think, my father saw that I was a challenging teenager at the time, so I think he actually sort of did a friendectomy on me and picked me up and put me over in France.
And traveling to France, and after that, did you have the love for traveling or international travel and getting to know the world?
Oh, well, yeah. Because when you grow up in the States, it's a very sort of insular education that you get there. So, when you learn history, it's American history,
Yep.
not world history. When you learn geography, it's American geography, not world geography. So, for me, that was a real eye opener to see that there was an entire planet out there that nobody told me about when I was growing up. So it was a true revelation. So it was a life changing experience living in France, and sort of opened my eyes. And really, I've lived outside of the States most of my life since then.
Okay. And when did you start your medical career, like going into study and that?
Well, before I went into medicine, I was a special education teacher.
Okay.
So my brother Tommy, my brother Tommy was a big influence on my career, it should be said. So he had an intellectual disability, and then he died when I was young, about 8,
Okay.
and that had a tremendous impact on all of us. But when he was alive, we would get involved in different community activities with Tommy. Doing interacting in a very positive way with him and his friends, which was great.
Yep.
And then it was a challenging time, I think, for my parents, because at that time, so this is growing up in the 60s in the States,
Yeah.
and the concepts of what causes brain injury and brain impairments was very sort of limited at that time. And there was the two most prominent theories there that were that it was either a schizophrenic mother or a refrigerator mother.
Yes.
And those are actually widely held beliefs. So I recall quite prominently, being in the back of the car as my parents would drive around the country in America looking for help for my brother. And then we go from neurologist to psychiatrist to psychologist, and really getting no help at all, because it felt to me a little bit like the story with the blind men and the elephants, where the blind men are holding each one part of the elephant, and you get a different description of the animal depending on which person you're talking to.
Yep.
So I felt like that was the state of brain and mind science, as it were, at the time, was that everybody had just a little part of the story, and nobody had the complete story there. So so he did get some help in the special education area. So I became involved as a special education teacher very, very, very young.
Yeah.
I didn't really need formal training at that time. So I did that for many years before medicine.
Yep. And was that in America, special education teacher?
Yeah, that was in medicine, but I also did it in France and in Canada as well.
Okay. And was there much difference of being a teacher in them countries, how much they were advanced, like to America, France, and that, doing special ed? Was it any different?
Well, I mean, the education system in France was so far advanced over the American education system in general, it should be said.
Okay.
Not particularly for special education, but
Yep.
The education system in general. Yeah.
And what year was that when you went into special ed?
Oh God, I don't know. I was really young. I did it as a teenager, so
Okay.
I did it even before I went to France. I was doing it as a sort of teacher's assistant.
Okay.
And then I continued in France, and then after I got back from France and did it when I was in university,
Okay.
then I went back and did psychology at McGill University in Quebec.
Okay.
And I also did some special ed teaching while I was there as well.
Okay. And so with the loss of your brother and that, it must have been a huge loss to the family. Now being a psychiatrist and emotionally, do you think the support back then and the understanding that people and doctors gave was different to now? What the support families can get and the help now?
Well, it is, but I think it's not different enough in my mind, I suppose. I suppose. To me, what was really missing there was the sort of fragmentation of the medical system, particularly with looking after people with mental health issues, with cognitive impairments, was really missing, and there wasn't a really holistic perspective. And I actually don't think there still is really.
Yeah.
But it's better than it was back then.
Yeah.
But I don't think we've come leaps and bounds, to be honest. So when I look at my career,
Yeah.
because I then did I then studied psychology, and I did medicine and internal medicine and psychiatry and chronic pain and neurology and epileptology. So all of these things I see, I sort of became the doctor in a sense that I think my parents had wished they had been able to take my brother to in a sense.
And because of that, do you think you as a doctor is, say, your bedside manner is different now because what you went through when a family may come in and how you may talk to them and have more time for them?
Oh, I like to think so. Yeah.
Yeah.
I mean, yeah. So, because I mean, I think when you have lived experience with the situation, I think that does make a big difference in your own empathy, your own approach. And so, I do like to certainly take the time with patients and try to get the full story of where they're coming from.
Well, I'm going to pick out your brain a little bit today of everything you can have done, but can you just explain how long it took you to get through everything you did with psychiatry and medicine? Can you just tell me how many years it actually took and everything?
Quite a few, I suppose. Yeah.
Yeah.
So I did well. So there's there was so there's a bachelor's degree. So that was I finished a year early with that. So that was did that in 3 years instead of four, and then I did medical school, which was 4 years, and then internal medicine, which was 2 years, pain fellowship, which was a year. Then I did 7 years of neurology training, 5 years of psychiatry training. And then I've done, in addition, I've done some more advanced study in lifestyle medicine and became certified in that, as well as particularly in epileptology.
Okay, well, that's a lot of study.
So,
And I suppose the study doesn't stop because I think when I was talking to the last doctor I talked to on this podcast, I think people think you get the diploma and that's it, and you just go out, but it's still study of new medicine, advances, and there must be study for you now, and it never stops.
never stops, but I would never want it to stop because I'm passionate about learning about the brain and the mind, and so for me that's it's a fantastic journey to be on, and I'll continue. It's a lifelong learning process, really.
At the moment, I don't want to make it controversy. How do you think Australia is looking after mental health at the moment?
Well, I think there's quite a few things lacking, to be honest. Yeah, I think there's a very sort of older, sort of 20th century style approach to a medical model to mental health here. An overemphasis on medication prescribing and a sort of adhering to myths about mental illness. Attributing them to biochemical abnormalities as opposed to the complex conditions that they are, and oversimplification of it and an over reliance on medication.
Mm. And is it true you had a lot to do with veterans and veterans? Do you?
Oh yeah. So I see a lot of veterans. So
Yep.
veterans. So I've been seeing veterans for many years in the States, in the UK, and for the last 20 years in Australia, from all the wars from World War II up to current, and they have a lot to deal with. That's for sure, and really limited resources. I think the Royal Commission was a great step forward in picking out some of the things that need to be happening, but the recommendations really still need to be implemented, and there's still a long ways to go to get to be able to have veterans get the help that they need and deserve.
And the resources, like you said, they need more resources. Is there enough, I suppose, trained people out there like you at the moment? Are we lacking or need more trained doctors in your field to kind of help your patient load as well?
Yeah, I guess I would like to see a broader cross-discipline training happening, which is really just not really happening here in Australia. So the sort of subspecialty of neuropsychiatry, where people train in both neurology and psychiatry, really isn't happening in Australia. I've been on the binational committee with the college for the last 20 years, trying to make that a recognized specialty with proper training, but it's been a long, hard slog, and I don't actually think we're any closer to having that sort of cross-disciplinary approach to training, which I think is really necessary for giving the best care for mental health.
Okay, and that must be frustrating. Do you think there's any advances on that, or at the moment, what would you say if you could have control of it? If you could have control, what would be some plans you would put in with your training, the years of what you have done, the understanding, the amount of patients you would see? What are some key things you would say would immediately help?
I would integrate, in my mind, I feel that, all neurologists should have training in psychiatry and psychology, and all psychiatrists should have training in neurology and psychology. And that should just be implemented right across the board for everyone, because it's this sort of, trying to separate the concept of mind and brain is a bit problematic and simplistic.
Have you saw since when you started, the age of your patients changing now, younger people coming into what would have been seen many years ago?
No, I've always seen people from all age groups. I mean, mostly all adults, but I do even see occasional do second opinions on some children that I can just do a second opinion on and refer them back to the pediatricians.
Yeah.
So no, I've always seen all age groups.
Yeah. In the sense, do you think there's children having more issues now than once before with the pressures out there? Do you think the pressures change with children there?
Oh, I think childhood is even much more challenging now than it was when I was growing up. Absolutely, yeah. I think there's so many more difficulties that children face these days that just weren't present. When I grew up, you'd spend most all your day outside, and you'd ride your bike around, and it was you really had a sense of safety growing up. You certainly spent no time behind a screen, and it was a much more interactive, and having playing with your friends and going to school was a much more integrated, meaningful experience, I think.
Yeah, and there's not as much other focus in. You had home, friends, not as computers, this and that, and this. You had just a short amount of things to kind of stay with. Now these days, there's computers.
And the pressure that kids have now, the pressure that they have in high school to maximize their grades, their ATAR score, etc., is really, I think, completely unnecessary. I think what we don't have is what we don't foster in childhood now, or in education, is really creativity and letting children follow the passion. So, I went to an experimental high school in the States, which was an amazing experience. So we had no grades, no tests, and it was a small 3-room school building. It was a free we call it a free school, and it was a spectacular. You could study anything you wanted.
Yeah.
And you could do it independent study. You could get another group of students doing it with you. You could engage any of the 3 teachers in the school or not, or you could do it alongside the university, or you could learn any way you learned most effectively. And that was an amazing experience, having independent study and being able to be completely self-motivated and follow your own passions about what you wanted to learn. And that sort of set my tone for my career and why I continued to study. I also went then, when I went to medical school, I also then went to the first 2 years of my medical school were also in independent study. And so we had a very similar opportunity to really focus on what you're passionate about and what's meaningful to you. And I think that's such a healthy way to learn.
Yeah, and I totally agree, because I've said this on this podcast and people I've talked before. Kids, or everyone, I suppose, it's not kids, learn in different ways. In school, you could have, a classroom of 24, and they're all the same, they're the same age, but 10 of the kids so understand book reading and maths, but the other 10 may not. But you take them into the next class with someone who says, okay, we're going to use a tape measure and measure up, we're going to measure this way, and they get it instantly. And then you swap it, and the other kids will try to build something they can't, but you put them in front of a maths book and they learn immediately.
Right. Yeah.
Yeah. So I totally think, we need all different ways for kids to learn, just not that one certain way. So I totally agree. Tell me a little bit with what you do now. I know you with your clinic, and what's the certain things you do now with your clinic?
Well, I have two major foci at the moment. So one is veterans health. So I do see an awful lot of veterans, and they often have traumatic brain injuries as well as mental health comorbidities, chronic pain. And then the other aspect of my my clinic is people who have brain injuries. Many of them traumatic brain injuries, and but I also see people with developmental disorders as well. So. And so yeah, and we're in the process of setting up intensive treatment programs.
Yes.
For both of these groups, so residential intensive treatment programs, both for the veterans and also for people with traumatic brain injuries. So this will be 4-week blocks of treatment where you come in and it's an alternative hospitalization program. So you're outside of the hospital, but you're in a nice nature setting, and so that promotes health. But you've got a multidisciplinary team behind you of neurologists, psychiatrists, rehab specialists, pain specialists, allied health, and you're also doing following some lifestyle medicine, learning about diet and exercise. Yoga, mindfulness, these types of treatments as well. And alongside that, we have some unique equipment that really doesn't exist anywhere else in the Southern Hemisphere. We have a collection of equipment that uses robotics and artificial intelligence, virtual reality, gamification, and functional electrical stimulation to help people who've had traumatic brain injuries treat the pain, treat the mobility issues, and also do the cognitive rehabilitation in a fun, interactive way that's very much neuroplasticity based.
Okay.
So it's very focused on maximizing neuroplasticity, the concept that the brain can heal itself.
This is where I want to go, because I've heard some of your talks. I think this is an amazing area to go in, and I have heard you say it, and people say it. You can change your brain, and you can help yourself by using this skill, can't you?
Oh, absolutely. So you can change your brain, and you can heal your injuries even many years after the initial injury. You can do that at any age. So there's there's all sorts of myths that you need to focus on that and do that only immediately after a brain injury or only in childhood. And certainly there are windows of opportunity where neuroplasticity is more active than others, but really neuroplasticity is something that you can do at any age, and you can do months, even many years or decades after your brain injury.
Yeah. This might be a little bit of a weird story in that, but like you said, just changing your thought, your brain, and even helps with depression and anxiety. I remember you think it might come from someone who's, someone who does meditation and that, but this came from a bush person I know. I call him a bush person, like an outback guy. And I was talking to him once, and he's telling me that one of his friends had a child, and the child had anxiety about going to school. And this is 20, 30 years ago.
Mm-hmm.
So he said to the child, he said, oh, there's this study that if you get up in the morning, have a glass of water, and get on your toes 10 times up and down, and then go to school, that you come smarter and you'll love school.
Oh,
And
okay.
what he did
Right.
was he did it for a month, and then he saw this bush guy saw his dad a month or two later and said, "Oh, how's he going?" He said, "Oh, he loves school now. He's not having any anxiety." He said, "Where did that come from? That's an amazing study." He said, "It wasn't a study. I just said something, put it in his head, and it worked."
Yeah, you believe something, it becomes reality. That's exactly right. Yeah,
Yeah.
Absolutely. So you believe that you can do something, you absolutely can do that. You can achieve that.
Yeah.
You've got to believe that you can do it.
Yeah.
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 And that's like the whole thing when you have a placebo response, for example. It's the same thing. That's really neuroplasticity working.
Yeah.
When you have a placebo response, is that you believe that you are doing something that is going to improve your well-being, and your well-being improves. So believing and having you have to change the way you think.
Yeah. Exactly. And with the neurons and that firing up again, can you explain a bit this? I know that's part of what you do with helping people's neurons. Is it neurons fire up again?
Yeah. So with neuroplasticity, it's about, you can have new neurons occur. You can have neurons repair themselves, but you can also have new connections. So and I think this is actually a much more common way that you can actually have new pathways form in your brain that allow the nerves to function normally. But you've got to, the key to making that happen is repetition. So the mantra that goes for neuroplasticity is neurons that fire together, wire together. So if you continue practicing, whether it's a movement, a thought, any aspect of your rehab, and you continue practicing that, then those neurons will continue to fire together, and then they will continue to wire together, so that becomes your new reality. So that was Dr. Donald Hebb, who I actually studied under at McGill University. He was a sort of
famous
psychiatrist. He's considered was a psychologist that I studied under, who is considered by many sort of the father of modern day neuroplasticity.
Yep. And is it true that you actually have a certain amount of neurons you're not using, like a certain amount what aren't getting used, and you can start using them, or they're not actually being used in the body?
Well, yeah, I mean, people say you only use whatever certain percentage of your brain or something, but that's there's no. You're actually always using all of your brain.
Yeah.
However, the number of connections that you can have between the different parts of your brain are infinite.
Yeah.
And so you never run out of different connections. But there was a myth that you only use 10% of your brain, but that's not actually true. We do use our entire brain.
Yep.
However, what counts is not just using your brain, but actually, forging new connections within your brain so that you can maximize maximize the power of your brain and the power to heal yourself if you have a brain injury.
Can you explain just a little bit how one of the machines work? Just say someone might come in one of the machines. Can you just explain a little bit?
Oh, sure. Yeah. Well, we have quite a few. I mean, that does all sorts of things. It works on mental health, works on cognition, works on movement of every muscle group. So one of the machines, for example, is if you have weakness in your arms, hands, or fingers. They all have games, and all the games actually line up with each other. So you can play one game when you're working on your arms, and you can play the same game when you're working on your legs, or the same games when you're working on your cognition. So they all actually line up with the games go across the different platforms. But for example, if you're working with your hand, so one of the games is a balloon game. Okay, so the balloon, so you're riding in a balloon, and the balloon will go up, over mountains and under bridges. So you see this pathway that you're going in, and so, but in order to do that, you've got to move the muscles in your fingers. Okay, so if you've got paralysis in your fingers, then you need to move your fingers up and down so that you're making that balloon go over the mountains and under the bridges.
Yep.
And then if you and then you get points for going up for that, and the degree of difficulty that you're doing with that. So you can keep score, so you get immediate feedback on how well you're doing. Obviously, if you hit a mountain or you hit a bridge, you've got to start back over again. So it's like a video game, really. And so, but you can see yourself. You can see yourself, within a single session, making tremendous improvements.
Yeah.
And so when you repeat that over and over, that's when these new connections start, and that's when the neurons that fire together wire together, and you can actually, people who have minimal movement in their their fingers or hands can learn to actually power their hands and fingers again. So we've also got a for people who have really very limited power. It hooks up to EMG biofeedback, and we also have it so that it hooks up to functional electrical stimulation. So even if you have minimal movement in your hands or fingers from a brain injury, for example, you can learn to go over the mountains, under the bridges with even the very smallest movements. And as you keep practicing that, then you become able to do it without the electrical stimulation, and the EMG biofeedback picks up even the most subtlest of movements that you're able to do. So you are sort of enhancing those pathways to make those fingers move. And so in your brain, that's finding new pathways to make that happen. And so once you found those pathways and you're able to do that a little bit, you keep practicing it, and within a relatively short period of time, you're suddenly able to get power back.
Okay. And it's about two things, I suppose. If you do have children who have to come in, it's a lot better for children to keep their concentration and want to do something. So it makes it interesting. And I suppose, I was a personal trainer for over 30 years. It's like personal training, isn't it? It's building the muscles. You keep going in, the muscles get stronger.
Absolutely,
the brain works.
Yeah. That's exactly it. It's just like personal training.
Yeah.
But by gamifying the process, it makes it fun. So not for children, for teenagers, for young adults, but realistically for everyone, because doing this, in traditional rehab, doing the same thing over and over again can get pretty boring.
Yep.
But this makes it very engaging, and you can compete with yourself. You can compete with other people, and it's like any sort of video game. You keep practicing, and you can get better and better, and it's very interactive and very fun.
And I suppose with the computers and everything, you can see the instant improvement. You can keep results better, and any changes, or when the person comes in, you see that result straight away. What helps then, with the studies of what's going on.
Yeah, so the therapist is able to see that, but the patient's able to see that.
Yep.
You're seeing that your score has gone up in just a few sessions. Your score has gone up from 10 to 70.
Yeah.
And you can see that you're actually improving your own power.
And how often does someone come in to do that?
Well, this is why the intensity of the program is actually a very important aspect here.
Yep.
So this is why we bring people in, and so we have blocks of 4 weeks. We encourage people to come for the full 12 weeks. To do 3 4-week programs, but you're coming and doing this on a daily basis, so that you're actually having this rehab experience on a daily basis. Keeps that key concept that my mentor at McGill had, which was the neurons that fire together wire together. You've got to keep doing it. It's that repetition that makes the neuroplasticity possible.
Yeah, and I suppose it's like when people do give up or anything in life, or even, you can say maybe go to a retirement home, and people say that people pass away a lot faster. It can be when people do give up. It's in that sense. If you mentally give up, your body will shut down.
Yeah, absolutely. Yeah.
With that, I know, like you said, you do a lot with mental health, and I have done life coaching, and really believe in mental health. Tell me, like we said, we talked about that there could be more done about it, but at the moment, what do you think is affecting most people? I know that's hard to say. Is it just all things like life, money, careers, and all that? Is that the number? Some of the number ones.
Well, I think I think it's best to think of mental illness really not in a sort of straightforward. You have a biochemical abnormality that's causing something, because that's really a myth.
Yeah.
Really it's a the approach I like to take is a biopsychosocial spiritual approach.
Yeah.
Because you have biological factors in any aspect of one's mental health, which may be genetics. It may be things like hypothyroidism. It may be hormones, or it can be a whole range of different aspects that affect your mental health that are biological. Then you've got the psychological aspects, which are equally or even more important, and that's how you think about it.
Yeah.
The mindset that you take to your own mental health. And so it's very easy to get yourself in a negative tailspin with negative cognitions and sort of catastrophize things, for example, and become paralyzed with depression or anxiety as a result. Then you got the social interactions, which are extremely important. That social interaction, that connecting with other people is really I think in many ways the most important. That interaction, particularly with people that you're close to in your lives. I think that's, when you look at, there's a very famous study from Harvard looking at what makes people healthy and happy. And they've been following people for, I'm not quite sure how long the study's gone for. It's been going since World War II, so quite a long time. And they've been looking at what makes people live longer, what makes them healthier, what makes them happier, and the results are astounding. It's very much the connections you have, and it's the real connections, not how many friends you have on Facebook. It's the real connections with a small number of people that make a difference. Yeah. Those people that you can really count on, and that's what makes people happy and healthy, that by far more than anything else. So those social connections are vital. And then the spiritual aspect of mental health is also equally important. And by spiritual, I don't mean religious. Some people are religious, and some people are not. But everybody has a sense of why we're here, and that sense of meaning is I think a very important component of people being healthy and particularly in recovering your own mental health. Everyone, we need a meaning. We need to have a sense of purpose and passion and meaning for why we're here and what we're doing.
I think that's so great what you said. And my wife, who you just met before coming in this year, she's very smart. She reads a lot like me, and everything you said there, she works with. She's very smart with all that, understanding when she needs time out from someone, she will, and understanding the energy you can get off other people, because other people can drain you as well, and you've got to be careful how other people can drain you and use you as well. And I suppose it's a weird thing. You can call them a human vampire, where they'll drain the energy from you because that's what they're there for. And amazingly, when you back off them or not giving them that time, they disappear fast. And that's not easy as well. And just that's having that time away, time for yourself, time for your family, time for friends is really important to have that balance. And I think there was another study that, as you said, is one of the, talking about Karen, my wife, is one of the most important thing is a mother.
Oh, yes. Yeah. Yeah, absolutely. Yeah. The effect of your mother, your family interactions in general, but the mother plays a particularly key role in nurturing and love. Absolutely.
And one of the other things, like your job, my wife's hairdresser, and there's a lot of jobs like I said, you're taking on a lot of emotions and taking on a lot of people's energies. And something I have always believed in, what spiritual or whatever you want to call it these days, is I believe what we do. You wash your dishes, you wash your clothes. I think it's really important to cleanse yourself. I think a shower or bath, whatever you do, is very important, because it's like washing off what's happened that day. Washing off that energy is a great thing to do. I don't know if that makes any sense, but just washing off all that energy.
Yeah, absolutely. Self-care is so important.
Yeah.
And that's being clean, washing yourself, but making getting the proper nourishment and exercising, looking after your well-being.
With going into things like, I suppose, schizophrenia and that area of medication, do you think some of the new things, like you're saying, things like, talking about just mind health, and that can be just as, help that just as good as medication? I know that, medication is necessary for certain things, but do you think sometimes we rush into medication too fast?
Oh, absolutely. I think I mean the most international guidelines work at for depression or anxiety, for example. The treatment of choice. The evidence is very clear. The treatment of choice is really cognitive behavioral therapy and other related psychotherapies. That psychological input should be number one before jumping right to prescribing any medication and other therapies such as like prescribing exercise therapy. There's a very strong evidence base to show that regular exercise is very powerful in defeating both depression and anxiety. So really, people jump to a prescription for antidepressants very, very quickly, but antidepressants aren't for everyone. And in my mind, that for most people, they're not first line. I mean, for some people, they can absolutely be life saving.
Yep.
But for most people, they're not first line, and you don't want to jump to that immediately when there's so many other equally or more effective treatments available with far fewer side effects than the medications.
And I have heard you speak about this before, and I believed in it for a long time. Sometimes the difference between depressed to being fatigued, we take sometimes being fatigued straight away as depression, then looking at what's the cause of the fatigue straight away, blood test, and doing test on iron or hormones and things like that. Do you agree with it?
Oh, yeah. It's very, very, very important. Just because you're depressed or fatigued, you've got to look for underlying causes. Is the thing. So when you think about it, really psychiatry as it's now practiced, as it's now defined with the DSM-5, which is the the diagnostic categorization system, it really focuses on things that are idiopathic. Idiopathic is one of my favorite words in medicine, because it comes from the word idiot, and it means we don't have a clue what causes it.
Yeah.
But when you look at depression, for example, or any condition in the DSM-5, there's always the exclusion criteria, not due to any other medical or neurological or other known cause.
Yeah.
So psychiatry in that sense is the study of the idiopathic, but there are many medical neurological causes of depression and anxiety. So things like thyroid, other hormone changes, anemia, seizures, so many causes, and vitamin deficiencies. If you don't actually do some basic testing and find out if there is a secondary cause, then you're going to miss it. And no matter what medications or psychotherapies you throw at it, they're going to be wasted.
And there's all changes in different parts of your life too. Like when women go through menopause, and that can cause hormone changes and depression and that as well. And sometimes we run into, again, the medication straight away, just looking at certain medication to fix that, when you might be able to be on something what helps, but doing other things to help it at the same time.
Yeah, no, I think that's right. And so people, jump to medications, far too early, and as a result, and there's also the other thing that happens is there's not a lot of communication between the different medical specialties. So medications tend to pile up the more specialists you see, and so I tend to specialize in people who have very complex comorbidities, and as a result, they're on many medications from a lot of different specialists who usually aren't talking to each other, and most of them are unnecessary. So I did an audit of my practice when I was at the Institute of Psychiatry and Epileptology in London, and we were a tertiary referral center, and the average number of medications for people who would come to see me was 25. And so So and obviously they didn't require 25 medications. So so one of the things that I would immediately start doing with virtually everyone I saw was deprescribing with dramatic effect. So you have a lot of people who are treated with multiple antipsychotics, for example, but they're not psychotic. They have no psychotic symptoms. But oftentimes antipsychotics are used for off-label, as it were. And a number of medications that will interact with each other. So bringing it down so that you have people only on the essential medications that they require, I think is actually a very, very important part of their treatment, particularly when they do have multiple comorbidities and are therefore on polypharmacy or taking more medications than they necessarily need.
And like Prozac and that. Now that I can't think of the name of it, but CSRs, or is it
The SSRIs? Yes. Yeah.
Now they're similar to the Prozacs, are they? Or
well, Prozac is an example of an SSRI. So that was the very first SSRI. And so SSRIs do have a place in some people with depression and anxiety. But as I said, there's so many other treatments that are just as effective. And the issue that you do get with SSRIs is they do have side effects. They can make people very jittery. They can interfere with sleep, make them agitated. They cause a lot of sexual dysfunction, and they can become very difficult to get off. So all the studies for antidepressants were really very short term. Most of them were just like a couple months, and really very few were more than a year. But you see people now staying on these medications for many years, and that makes it very difficult for them to come off. And you have to do it very, very slowly because
it can be dangerous.
You get with very severe withdrawal symptoms with it is the bottom line. And people think that their depression is coming back, but it's actually not the depression coming back.
It's the withdrawal.
It's the withdrawal symptoms that's inherent in the medication. So even if you were never depressed a day in your life and you put on an SSRI for other reasons, and then you stop that suddenly, you will get depressive symptoms, and you can even become suicidal because that's sort of built into the medication.
Okay. And like a drug like that, can that, like someone might be put on that because they believe they got anxiety or depression, can that end up numbing you just as being feeling you already got depression? So with the long-term use can cause something called antidepressant induced dysphoria. Which feels a lot like depression. People feel it's mistaken for having a refractory depression or something changing in your depressive disorder, but what it actually is a side effect of the long-term use of the antidepressants themselves. So but it's very important if you suspect that, it's very important that you don't do anything about that on your own. You don't want to take yourself off of these medications on your own. You've got to do it in conjunction with a psychiatrist, and I think with a pharmacist as well, who so that you can do it very, very slowly and gradually in a safe way. And would just say if you had a patient X or something, and you were withdrawing off it, like you said, you'll do it over a long time, would they be going on to another medication, would you think, or you would be wanting to take them off that to see what happens after they're withdrawn and they're fully off the medication?
It depends on the situation. But for more often than not, I would like to see how people do off the medication, and take them off without necessarily jumping straight away to another medication, because then you don't know what's causing what. You don't really know what side effects are from the medication and what's the underlying illness until they've been off the medication for a while, and it can take many months to come off a medication. So some medications you might want to withdraw over 12 months or more. If people have been taking it for years.
And painkillers and certain tablets like that can give you make you depressed and that too, can't they?
Absolutely. Things like the benzodiazepines and the opiates can cause depression themselves, and those also you need to wean off very, very slowly as well. But people can absolutely come off of them.
What you might have to be careful what you say, but with the new psychedelic area with soldiers and that traveling to Mexico and different areas of first responders and other people traveling to Mexico now to do that, what's your thoughts of that?
Oh, I think the evidence is too early on that. In my opinion, you're talking about the use of psychedelics
Yep.
like MDMA and
Yep.
psilocybin,
Yep.
LSD.
Yep.
I think I mean back in the 60s, these medications were thought to have some therapeutic potential, but then the research was stopped there in the 70s. There's really been very little research since. There's a reason for that. They're powerful medications with powerful side effects, and yes, they do certainly have some I think amazing therapeutic potential. But we're so early on in the research that I think it's very difficult to know, which conditions respond to which psychedelics and what doses, and it always needs to be done with very close monitoring and with concomitant at the same time psychotherapy as well. You can't just take these drugs and expect to be cured. It has to be done with a very closely monitored psychotherapy. So it's not an easy process. It's a complicated process, and it's not for everyone, and it's not for every condition. Because it does have a lot of side effects. So the psychedelics can all cause something called HPPD, which is a type of perceptual disorder where you continue to see like the types of hallucinations that you would see while you were under the influence of the hallucinogenic state, and you continue to have them like all the time, all your waking hours, and that's a very distressing condition and can be a lifelong condition, which most people don't realize. And it's not at all a rare condition. It's actually a very common side effect. It occurs in about just over 4% of people who taking psychedelics.
Just about like seeing things and everything you said when you're coming off it or on it. It's very interesting. I was actually speaking to Jacob about me being blind, and I'm totally blind, but haven't been able to see proper. You can say full vision. But when I did lose all my sight in one of my eyes, I been having something you might know is called Charles Bonnet syndrome.
Oh, yep, Charles Bonnet syndrome.
And it's amazing. So and when you say what that can affect those people coming off that, if they do or have a trip from it, it's amazing. I have had this for a long time where there's bright lights or having people walk at me or doors look like a wall comes up. So it's amazing. I don't know if you didn't you would understand what it is or where it came from, but I believe it came from one of the psychiatrists in the war days or something, when all the soldiers were coming back with losing eyes and head trauma, and they thought they were crazy, but he looked at it that it was because that them nerves and the neurons, what you're talking about, were still firing in the head.
Absolutely.
Going just to children a little bit now, with we'll talk about children, but with hyperactive ADHD, what they call it these days. What do you think of Ritalin and children going on Ritalin early or young, or now there's so many adults going on it? What's your belief in this area?
Well, it certainly has taken off in recent years. I mean, then there's no question that certainly for some children that can be make a massive difference, particularly in their educational performance. That it makes it easier for them to learn and participate in class. It's with any medication, it's always the risk versus side effects. That's what you need to look at. You need to look at that careful balance of risk versus side effects. So, all those stimulants and the amphetamines all have some potential long-term side effects, which can include psychosis. And I think that's important to realize, to be on the lookout for that. And to also look at there's lots of other cognitive and behavioral ways that you can improve your attention and concentration. You don't necessarily need, even if you have ADHD, or if you have problems with attention and concentration due to any reason, which may be a brain injury, may just be the effect of long-term use of social media. It can be all sorts of things that affect people's attention and concentration. There are lots of cognitive and behavioral methods that I think should be used before jumping to medication.
Okay, so children, looking at because now so many adults talking about they have it. If say again, patient X adult comes in and talks to you thinking they have it, what would be your first questions and thoughts? Just say if someone's out there thinking I may have it, what's some of the triggers or thoughts of someone having it?
Well, generally, ADHD is really thought of as a developmental disorder. That it's something that occurs in childhood and then can also be residual and affect you then in adulthood. So, if an adult comes to you, then you really need to take a detailed history of their learning, their behavior, their cognitive abilities, their school history, growing up. I think that's really important because it is considered a developmental disorder. And then I think just because I think the vast majority of people have trouble with attention and concentration, and that doesn't necessarily mean that you have ADHD. And also just because you feel better or improve if you take amphetamines or other stimulants, also doesn't mean that you have ADHD, because anybody who takes amphetamine or another stimulant will feel better, will concentrate better, will learn better. You don't need to have ADHD to feel better and have your attention and concentration improve with that. So there is some rigorous testing that I think should be undergone. Rigorous neuropsychological testing should be undertaken to really be clear about that diagnosis. But the most important thing is to look at the risk-benefit ratio of prescribing the medication, to look at other lifestyle medicine and cognitive and behavioral approaches to treating the ADHD, and not just jump to using the medication straight away. And if you do use the medication, you gotta follow that closely for long-term adverse effects.
Okay. And what's not going on the medication? What's some kind of plans you could set for someone? Just say they said they don't want to go on the medication, or you said, I don't think this may help you. What's some things you would set out for them to do?
Oh, well, we have with our equipment that uses things like virtual reality and gamification. There's lots of things that we have that do games that can improve cognitive abilities, attention, and concentration.
Oh wow!
So that's one approach that we do, which is a very neuroplasticity focused approach. Many psychologists will use different aspects of cognitive and behavioral approaches to treating attention and concentration issues. It's a very common symptom. I would say the vast majority of people have attention and concentration problems, particularly these days where attention span is so limited because of everyone's use of social media. That really affects everyone's attention spans. And there's so many other approaches that you can take besides prescribing medication that can improve that.
And I suppose it comes down to diet and exercise too at the same time for that?
Absolutely. Diet and exercise are absolutely critical for that.
I don't know if this is true. Like I said, I'm pleased someone with your intelligence and how long your experience is. I once heard with ADHD, sorry, I get that, that the thing what is good to have is exercise, is good dopamine, and your sugar levels proper. And they say if they drop or they're not at good levels, that's when you think you can actually have it. But your your sugar levels perfect, your diet perfect, and that dopamine area good. That would help as well, wouldn't it?
Yeah, having a good a good balanced diet, which is really the most important thing with any diet is you really want to be avoiding sugary foods, high carbohydrates, and you really want to be avoiding in particular any processed foods.
Okay.
And that's really a big problem both in children and adults. Eating those high processed foods, and so the vast majority of foods that we have access to these days are highly processed.
Okay. Jumping away from that a little bit, just with people having strokes and areas after something horrible happened to their medical situation, is people who have come from strokes. I only with some of the study and learning I have done before you came on, I didn't know they can lose their smell for a long time, or taste, or areas like that can happen to them.
Oh yeah, that's very very common in stroke. Very very common as well in traumatic brain injury. You see
Yeah.
that people will lose their smell and taste as part of the brain injury. Yeah.
Okay. And is that just the brain injury? Has they worked out why it happens, or it's just part of it, or?
Well, yeah, I mean, it has to do with what parts of the brain are affected. But if you're getting like the olfactory nerve, for example, then that's which is, that's a very commonly affected nerve in to be affected in a traumatic brain injury. Then that can cause you to have a loss of smell very, very very frequently, and that affects your taste dramatically.
And people can get it back, or sometimes not, or what you're doing can help that.
You can get it back. That's a bit more challenging.
Yes.
So we don't have any specific therapy to get that back, but they're at the moment ourselves. But I do know in the States, I am aware of some people who are doing taste and smell reparation therapy. So they do exist. We haven't implemented them over here as yet.
What about again? Last time I was talking to a doctor about people who can wake up after a tragic thing or accident, or after an operation, and they're speaking a different language.
That's a fascinating syndrome, foreign language syndrome. Yeah, yes, it's well documented. That, and I think what that shows is the amazing, it's just the amazing untapped potential that we all have in our brain, that you can people can have somehow achieve multiple language abilities or musical abilities or other creative abilities that were previously unrealized.
Yeah, and that's where it's then turning to a little bit different, a bit darker. When you may have a brain trauma or that as kids. Is it true that at times that some of the people who have become criminals or serial killers or anything has been proven that can change the way in the brain, or something can happen to the brain?
Well, yeah, I mean, yeah, that's sort of out of my area a bit, but we have the whole forensic psychiatry area with serial killers and so forth. That's an area that I have to say I have a little understanding of how people become that way. Certainly, brain injuries can can affect people's sort of moral patterns. At times, can affect their behaviors, can affect all aspects. But I think it's oversimplistic to say that it's related to brain injuries in any way. That there's so many other psychological, social factors involved in why people become like that. That's a very complex why people become criminal.
Yeah, and not on that, but genetically, just say if there's a genetic brain issue, that can carry on to the next generation as well. It can, if there's a genetic issue.
Yeah. Well, certainly. So the genes affect our brains, affect our cognition, affect our behavior in so many ways.
Yeah.
But the important thing to remember with our genes is that they are all changeable.
Yeah.
So we can they used to talk a lot about the nature versus nurture issue. That's really no longer that big an issue, because we realize that everything is both. Everything involves your DNA and your nature and what you're born with, but it also is equally or even more affected by your upbringing and your environment and
Exactly.
and how you adapt to it. What your opportunities are, how you think about things. All of these things really greatly affect who you become, your personality, your cognition, your behavior, all of those things.
Yeah, it's generation trauma and changing that. You might say, I grew up in the poorest house. You're the one who can change that. You're the one who can, go out. You don't have to think about being poor. You can, you could come a billionaire or rich, but you can change that process, or your next generation, your children. And that's, I mean, we've got a good life, me and my wife, but something that we have saw with our children. We haven't, closed them in. We let them, when they were old enough to go out in the world. grow and express themselves, and that I believe that grows their minds and helps that next generation of their children as well.
Yeah, absolutely. Yeah. So we everybody has the power to change themselves and become the person they want to become.
And I think, and then when coming back to another circle, when we talk about people who do look after people from, strokes and traumas, the carers too, they go through a lot too. They're going through it in some ways, and I can understand. I can do most things myself, but my wife has to help me with certain things, seeing and everything. So I suppose at times you could say she's Karen. I shouldn't say she. Karen's a carer for me at times for certain things I can't do. Of course, I can't drive, can't go and do this. We have to understand that the people who are looking after you go through trauma as well, and sometimes I think we forget that the carer is going through just as much pain, because yes, you're in the pain, but they're seeing the pain. Plus, they try not to show the pain. They're living with it every day, and they're seeing it every day, and that their sympathetic feelings towards you that eats them up as well.
Well, care burden is one of the more underappreciated aspects of disability care that we have in Australia. So, the vast majority of carers are family members, friends, unpaid, and I think. And there is, for many people, that can over many years become a burden, and we always need to look at the well-being of the carers and how they're coping, and sometimes they're not even allowed in the room. You've got to have them in the room, get their opinion, and make sure that you're taking their needs into consideration and well-being.
And I think they need that respite time away from it as well, because, and I think it's both partners feel different towards each other with it, and it's got to be balanced, that both have to understand each other, but both need still time out from each other and understand each other's space. And I think something like Karen's very good at is space and your own time's very important to I suppose it's a form of meditation, whatever you want to do, or mindfulness, or whatever they want to call it. I suppose mindfulness is like, I think we came up in this area, in the Western area, that word, because we didn't want to use the G or certain things like that, from other places. But I think, that time out, the time away, or the time of recovery is one of the biggest things for brain health.
Absolutely, yeah.
We're getting to the end. Hopefully, you have in mind the questions, and the questions have been okay.
Yeah, all good.
Tell me, what's I know with your clinic and that, what's the plans for you for the next few years with the clinic, and where you want to take it?
Well, at the moment, we're launching these intensive residential treatment programs for both for veterans and also for people who've had traumatic brain injuries. I think this is a very, very exciting phase in what we want to do. So these are biopsychosocial, spiritual models of care that are very neuroplasticity based. Again, using the AI robotics, the gamification, virtual reality as part of the rehabilitation, and having this intensive process that includes also treating the mental health issues, treating the chronic pain, treating the mobility issues, treating sexual dysfunction, treating relationship dysfunction, all at the same time. And it's a full treatment of complex comorbidities that so frequently go with brain injuries and with trauma.
Actually, going just about that, what's a thing that especially men don't want to talk about, sexual function and things like that. That's another where we go straight to, I believe that people go, well, we go straight to medication, take this, take the blue pill, what's this? But sometimes it's not that. It's, again, it's, I suppose you can say, an issue that you're not thinking's there, anxiety, an issue with, can be, even say diet, that area. Do you believe that?
Oh, absolutely. I think there are both there are many specialists in both men's sexual health and women's sexual health that I think are and there's a huge variety of different treatments available, and I think it's about men and women seeing specialists and becoming aware of those treatments, and then and choosing what's going to suit their lifestyle. But then there's the couple component of it as well. So I very commonly will recommend couple therapy to go with that, and you can have that can be sexual and related therapy, or more commonly it can be just relationship related therapy. And there's a particular type of relationship therapy called Gottman therapy that I think has a very strong evidence base for keeping couples together.
Can you just give us just a bit of an outline on that?
Oh, so it's this couple who have spent the last half a century doing research on couples and looking at exactly what it is that keeps couples together. So they've devised a great therapy. They have some great books out there. Well, one that I might recommend for people is one called what is it? Something along the lines of Eight Dates, I think it's called, is the name of the book. And it's about, so this is something that you can do yourselves as a couple without even necessarily engaging a therapist. And it's eight dates that you and your partner go on. And it's topics of conversation that you have, that you two ask, questions that you ask each other during those dates to cover those issues, I think is really important.
And we are coming to the end, so sorry if it's been a bit too long, but I think that's so interesting because I hope I remember the other thing, but talking about couples, I have always said to people, is it amazing when you first get back, together as a couple, you sit on the lounge chair together, you hold each other's hands, you watch every movie, and then like children will come seeing you'll get kinder times on the chair. But it's amazing down the track, I've always noticed that grandparents or whatever, there's one chair one side, one chair. It's like the relationship has got a bit distant. Then keeping that closeness, as you said, going on dates. And I think something me and Karen do greatly, and something she's always been great at, is by you push each other in the relationship. When the other one's down, you help them, but you tell them, you build them up. You push each other in this relationship. You can't run 100 meters. No, you can run 300 meters. You make each other better. And I think that makes a relationship so strong when you make each other work on yourselves and each other.
Absolutely. It's about really understanding each other, really getting each other, really wanting what's in the best interest of each other. And it's that deep connection. And part of that is also spontaneity, going on dates, having fun, laughter, laughing together. It's so important.
I think that's one of the best places to finish off with, especially relationships. And I think it comes down, like the area you're in is so important. And I thank you for your time and your hard study and doing that. That takes a lot of commitment to do that. And, I have really enjoyed the talk today. But to finish on relationships, I think mental health in relationships is the main thing. We have to look after each other and look after each other as a couple. And I think that's one of the things to really look after with brain health, looking after each other.
Absolutely.
Well, last couple of questions. These are going to be quick ones.
Okay.
If you had someone hopefully you have enjoyed this interview and it's been okay, the questions, and I hope they have been, because I don't have set questions. I just go off. Like I said, I like just sitting down, having a talk to a person like we just met at a party, then having set questions.
Mm-hmm.
But if one of your friends, someone that you could say, hey, I think Alan would be good, or you could tell me that I could, maybe get a referral from you.
Absolutely. I'll come up with some people. We'll send them your way. Absolutely. Yeah.
Yep, if you can. And the last one, if you can get back with that, if you don't know one now, who's someone really, I don't care if they're famous, sport, book reader, anything that you would, if you knew they were coming on my podcast, you would sit down and listen to?
Oh, such a good question. Somebody, let me think. I think who's in Australia that you can actually get. I'll tell you who I'd like to have you get on your podcast.
Yeah.
Jacinta, the former Prime Minister of
New Zealand?
of New Zealand. She's
Yep.
living in Sydney now.
Okay.
I've seen her on many talk shows like Stephen Colbert, etc. I think she's a great guest. If you could get her, I think she'd have a lot of things to say.
Okay, you know what? I'll try her. Well, I put all my I always put offers out there to everyone. Again, I hope you have enjoyed and you felt like the podcast has been, comfy and respectful to you and everything today. And I'm finally really pleased that we got together. I want to thank Jacob, who's the new producer, plus one of our listeners who is always telling me about the show, and she's actually one of my Karen's clients as well, Norelle. I want to thank her as well for just being a great listener and always giving positive feedback. And we'll be back with the next podcast soon. And I thank you, Professor, for coming in today.
Thank you.
Alan Lewis Raw Conversation, where every voice has a story.